Welcome to the Deep Dive. Today, we're digging into something that, well, if you're in healthcare, you probably know all too well. Prior authorizations.
Oh, yeah.
You know the feeling, right? Those forms, the waiting, the endless calls, delayed approvals, paperwork mountains, and those denials that just stop everything.
It's a constant headache for so many.
Exactly. So if that sounds familiar, this deep dive is definitely for you.
But here's the thing, it doesn't have to be that way. What we're looking at today is how one U.S. hospital really flipped the script on this.
Flip the script. How so?
Well, they took this thing everyone dreads and turned it into something, well, streamlined, clinician-friendly even. And the key insight, the real game changer from the source material, they stopped seeing it as just billing paperwork.
Okay.
They started treating prior authorization as a core clinical operations function because, think about it, when it goes wrong, it messes with everything. Patient access, hospital flow, revenue, staff morale. It's all connected.
That reframing.
Wow.
Treating it as clinical ops.
Yeah.
That changes the whole perspective.
It really does.
So our mission today is to unpack that. How did they actually do it? What were the results? And maybe most importantly for you listening, what are the concrete steps you could actually use?
Yeah, what's the blueprint here?
Exactly. We're talking real, practical changes. Okay, let's get into it.
Let's do it.
So to really grasp how far they came, we need to understand where they started. The source paints a pretty rough picture, right?
Oh, absolutely. Before the changes, getting specialty approvals, the essential stuff took on average 10 to 14 days.
10 to 14 days, just for an approval.
Yeah. Imagine you're the patient waiting or the doctor trying to plan treatment. It just throws a wrench into everything.
That kind of delay has huge ripple effects, I imagine.
Massive. I mean, it's not just inconvenient. Think about someone needing, say, an urgent scan or a procedure. Waiting 2x just for the insurance, okay? That's added anxiety, potentially delayed diagnosis.
Yeah, potentially worsening conditions.
Exactly. And for the hospital staff, the source says they were spending hours chasing documents, calling payers, resubmitting requests. Just endless cycles.
Sounds exhausting.
Yeah.
And prone to errors.
Totally. And even small errors triggered big denials, a wrong code, a missing note. Boom, back to square one. It was incredibly stressful for patients, obviously, but also really demoralizing for the clinicians and the admin staff.
So it slowed down care, messed with scheduling.
Yep, slowed patient access, hit throughput, and definitely impacted the bottom line. Revenue takes a hit when things get delayed or denied. It was kind of a perfect storm of inefficiency.
It really shows how tied together admin and care are. If the admin side is broken, care suffers, period.
Couldn't agree more.
So how did they start fixing this? The source talks about moving from manual chaos to a managed system. What was step one? How did they make that shift?
Well, the foundational move wasn't some fancy new tech, interestingly enough. It was about structure and visibility. They established centralized visibility, meaning every authorization lived in one source of truth. Think about that one place to see everything: clear owners, timestamps, what needs to happen next. No more scattered info.
Okay, like a central dashboard.
Sort of, yeah. But it was more than just data. It was about accountability. They created a dedicated team.
A specialized team just for prior auths.
Exactly. Their entire focus was owning that workflow, from the initial submission right through to the final decision, including appeals.
So they handled everything, the paperwork, the calls.
Everything. Getting the complete submission packet together, coordinating all the supporting documents, scheduling those peer-to-peer reviews with insurers, all the follow-up calls, and managing appeals if things got denied.
That sounds like a huge burden lifted from the clinical teams.
It was. And a key part was giving clinicians real-time status updates, so they could actually schedule care with confidence rather than guessing. No more wondering, is this approved yet? They knew.
Wow. Real-time updates alone must have been revolutionary for them.
Huge difference. It moved from reactive scrambling to proactive, organized management.
Okay, centralization, a dedicated team, real-time visibility. That makes sense. But the source mentions something it calls the real differentiator, something about payer-specific precision. What's that about?
Right. This is where they got really smart. It wasn't just managing the process. It was optimizing it based on who they were dealing with.
Tailoring it to each insurance company.
Precisely. The team built what the source calls a dynamic rule matrix for top payers. Think of it like a detailed, constantly updated cheat sheet for each major insurer.
What kind of detail are we talking?
Super granular, exact clinical notes required, specific imaging rules. If you are looking for outsourcing services, schedule a demo today.